Good afternoon, everybody. Welcome to our Dinsmore and Scholl's Don't Be the Next Change Healthcare webinar today. As we come off of the end of Cybersecurity Awareness Month, we thought we would have a little bit of fun with a dark topic here and have some good information for you all today. And I would like to introduce our speakers today, starting with myself, Craig Horbus, partner here at Dinsmore and Scholl, and I head up our firm's cybersecurity and data privacy practice group. I'm going to flip here. Laura Fryan, partner in our healthcare group here at Dinsmore and Scholl. Jennifer Mitchell, also partner here at Dinsmore and Scholl in the healthcare group, and she also does cyber and privacy work here. And then Brian Murray, also partner here in our healthcare group. So with that being said, I'd like to kick it over to Jennifer Mitchell to get us started with our presentation today.
Thanks, Craig. I appreciate the intros. My name is Jen Mitchell. I'm a partner with Dinsmore. I've been here working in the healthcare space and in cybersecurity, leading our firm's healthcare privacy and security initiatives for quite some time now. I've been here 25 years and living in this healthcare space. So we thought that we would sort of just lay the groundwork for the exercise that Craig is going to run us through and talk a little bit about what has now been identified as the single most significant and consequential incident of its kind, really, in the U.S. healthcare system, and that is the Change Healthcare breach. This breach happened in February 2024, and it impacted. If you're in healthcare, you're aware, because if you're a provider, you're representing a provider, you're in-house, you were impacted when they turned off their systems as a result of trying to navigate and contain this incident from spreading even more broadly than it did. Change Healthcare is a subsidiary of United Health and responsible for processing, and this is crazy, but 15 billion medical claims per year. And this ransomware attack was occasioned on it by a gang called Black Cat, or at least claimed to be occasioned by Black Cat. They infiltrated using, a single password on a single user account, much like many of the breaches that we have heard about over the years. They are still using malicious email, phishing email, and accessing large systems. It harkens me back to I was looking back and preparing for this conversation today to the Anthem breach 10 years ago, almost exactly to the day before the Change Healthcare breach. Again, that was a malicious email phishing. These mechanisms are not new. They spread widespread disruption across our healthcare organizations, and in this one, they ended up being able to steal anywhere estimated between 4 and 6 terabytes of patient information, which is a huge trove of information. The breach impacted hospitals and physicians, pharmacies that couldn't provide services or medications, patients who had trouble receiving care during the initial impact. And as a result, we found a system where the government did step in and provide some guidance for us in terms of how to navigate that initial time period. HHS came out in support in March, I believe, and we have a timeline of events that transpired over a wide-ranging period of time. So everyone talks about the deadlines imposed for reporting, but you also have to drop a pin in those dates. And in the Change Healthcare breach, it was a very sophisticated and such a large breach that it ended up taking many months for Change Healthcare to begin providing notice. Just this last week, HHS updated its website, and just this last week, Change Healthcare confirmed over 100 million individuals were impacted. But this event actually began back in February. It was confirmed in February, on February 21st of 2024, the network was shut down. About a week later, they confirmed that the ransomware attack did occur, and that was confirmed publicly. In this case, they paid a ransom, and then the threat actors, who aren't to be trusted, stole it and left the data behind with a contractor. The data ended up, at least a portion of the data ended up on the dark web, while at the same time, a portion of the data was able to be retrieved by Change Healthcare, and the data mining began. That continued for many months until they were able to begin identifying the individuals who were impacted. So what we're going to run you through here today is an exercise to sort of make those decisions along the way in real time and begin to understand the complexities associated with these kinds of breaches. The costs can be astronomical. I remember speaking on these topics back when the Anthem breach occurred, and in other training seminars over the years. The costs, I think, of the Anthem breach were estimated back then 10 years ago to range in the $300 million range. The costs estimated for this Change Healthcare breach are exponentially higher. They're estimating now that this breach will cost Change Healthcare anywhere but around $2.5 billion to $3 billion, including $1.7 billion in direct response costs. So just to understand more of the magnitude, I don't want to take up too much of our time here today because I'd like to get us back to the exercise, but just to kind of lay the groundwork for how important it is for all healthcare organizations to really understand and improve as much as they can their cybersecurity awareness and protections to potentially avoid this type of situation from happening to your organization. So I'll flip it back to Craig.
Thanks, Jen. So we are obviously here, like I mentioned at the top of the hour here, is we are in Cybersecurity Awareness Month, and the one thing that we like to do is what we call kind of tabletop exercises, right? So the Change Healthcare breach was very public, impacted many individuals, could go on record as the largest data breach in US history, possibly even the world's history. And as Jen mentioned, astronomical costs involved. But at the same time, we have millions of people impacted, and we have astronomical costs involved. The one thing that we like to do as breach counsel in these situations and as lawyers is we like to take a step back and take intel from what's happened in situations like Change Healthcare and share it to help our clients, our partners avoid having a Change Healthcare 2.0. We like to avoid our clients going into a situation where they have to pick up that phone on a Sunday afternoon or a Friday or Saturday morning and call us and say, hey, we're having, we think technical issues, we're not sure, we're still investigating, but this could be a data breach. And we like to do these tabletop exercises, which are based on, it's purely fiction. It's information that we've gathered together over years of doing these type of incident responses, and we really like to kind of again have a little bit of fun with some dark topics here, and in an effort really to gain some insight or help your organization, help your clients potentially gain some insight as it relates to how they can effectively respond to their own situation. And the only way to do that is to really run through simulations, right? We call them tabletop exercises. The FBI does them all the time. We work very closely with our law enforcement friends, both at the FBI and Homeland Security. And they will tell you that, the best way to prepare for incidents, no matter what you're doing, is training, right? And so we like to do these kind of simple training exercises, and we like to have audience participation. So as part of this, we're really going to be laying out the fact pattern of a situation here, where we're going to ask all of you to kind of be part of that decision-making process with us. And hopefully we'll all make great decisions, and kind of help navigate us through kind of this simulated event. It's kind of if you're, an 80s kid, choose your own adventure, I like to call it. So we're going to kind of jump around a little bit here on some of these slides. But at the end of the day, what we're really trying to do here is really cause you, your organizations, or you for your clients to really think about some of these decisions that really need to be made within a short period of time. Some of the breach regulations out there obviously have very short windows, 72 hours for GDPR, for instance. But the host of bad decisions and good decisions made within the first 72 hours of any sort of data breach really helps define kind of the outcome of what's going to happen throughout the course of an incident, the response, the remediation, et cetera. So without further ado, we're going to kind of get into the fact pattern here. The rest of my esteemed colleagues are certainly going to be weighing in here as well as we kind of go through the simulation. But so we're obviously talking about Change Healthcare, so I thought it fitting to have a healthcare-based organization that was going to be the target of our IR here today. And so just to spell this out, we have ABC Cut-A-Lot Centers of Ohio. Their surgical group that's based in Ohio that has 5 regional locations throughout the state. And with that, I'm gonna introduce our players here, our team that's going to be part of the scenario here. We have our CFO, Janice Sharp. We have Calvin Cow, you later, our staff accountant, and we have Don His Best, who's our administrative assistant. And we'll sprinkle them in throughout the course of our simulation here today. But those are our main players. And it's a key to note here that ABC Cut-A-Lot, they do not have the expertise to manage their own IT infrastructure. So they've actually contracted this out with a company called Seren IT Solutions. And Serenity is providing really similar services that we would all see that a typical MSP or managed service provider would provide for whether it's a hospital system, surgical center, et cetera. One that was like ABC Cut-A-Lot, where we have multiple locations, but we have some centralized administrative functions, and that's what we have here with Serenity Solutions, who's handling that for us. Really talking about the installation and configuration of their network equipment, PCs, servers, firewall, security software, scanners, printers, ongoing kind of daily support, maintenance of network equipment, centralized offsite and cloud backup, administration and monitoring. And then they also are in charge of kind of doing some of the security awareness training to new onboarding employees kind of when they get hired. So that's kind of the background of what Serenity is doing here for our ABC centers. And then as part of that, obviously ABC is not the experts here, so they're relying on their service provider here. And they have advised them, again, that we're going to have a centralized offsite cloud backup system here where they store all of their PHI, right? All of their patient data is backed up and stored on a cloud-based server that they call the data barn. And ABC here, they address all their HIPAA privacy and security with privacy practices notices posted on their site, on-site on their site locations, as well as its website. And then they have a BAA in place with Serenity. And one kind of key note here is that, again, ABC is just, they're in the business of surgeries, right? So they're not super highly focused on kind of what Serenity is doing. They rely on them to handle all their IT stuff. And as part of that, they have not gone through any sort of tabletop exercise here, and they don't have an incident response plan. They don't have legal counsel that's really helped them kind of, from a compliance standpoint, put together a risk analysis of their systems, and they certainly do not have what we call an IRP in place that would help them if they were to be the victim of a cyber attack, to help them kind of navigate through that. So with that said, we're going to get into our actual what happened here, right? So Don is best is logging into his workstation on a Monday morning here, and he opens his email. He sees a new message that says ABC has received a new fax, which he promptly opens. When he opens it, our best friends who also were the infiltrators of the Change Health network system, Alpha V Black Cat, has hit us with a message here that says your data has been stolen, your network is encrypted, and the data will be published on our Tor site. So the Tor site, obviously, for those that may not know, is the Onion router. So it's the Onion sites which operate essentially the dark web, which is a subset of an online collection of Onion browsers. Onion servers are located all over the world. That if you dabble on them, you can find some really bad things, some really bad actors. Very dangerous to be lurking out on the Tors. But they're sending you to a Tor site where they want you to go to their Onion browser, and are hitting you with a ransom demand here of 15 Bitcoin to pay that off. So I think I took a look at the market rate of Bitcoin this morning, of sometime hovering around $63,000 a Bitcoin. So do the math. It's a hefty sum there that they're asking for all of the data. They're also offering, as part of a gesture here, as part of their goodwill, that, hey, you can contact us here, and we're going to give you kind of what we call in the business proof of life, right? They're gonna say, go to this Onion site, this Tor site, and we're gonna give you one free sample that we prove to you that not only did we take your data, we did encrypt it, and we're going to give you the key to encrypt a small file, right? A sample file that's going to prove to ABC that their data is in fact breached, it's taken, and it's fully locked up. But if they pay this ransom, this 15 Bitcoin, as the Alpha V Black Cat group has promised, they're gonna give you your stuff back, right? So Don is best is panicking here now. He doesn't know what to do because, again, they don't have an IRP in place. So calls Janice, calls the CFO, calls Cal immediately. And they decide, well, okay, this is not our area of expertise because we hired Serenity here, right, to handle this kind of stuff for us. So what do we do? So they decide, okay, let's call Serenity Solutions, and they pick up the phone and they call their primary contact at Serenity, and Mr. Ian, over his head, answers the phone and says, oh no, that's terrible. He rushes immediately over to ABC. And he discovers that, in fact, the entire data barn server has, in fact, been encrypted, and ABC no longer has access to any of its data. So ABC is not starting out on a great Monday morning here with everybody. And before we kind of delve into some of the first decision points here, Jen talked about some of the costs, right, of a breach related to Change Healthcare. That one's going to be billions. But let's take a more realistic look at what these actually do cost. And the data is actually still pretty staggering for what these things cost. Right now in 2024, you're looking about $4.8 million. That's kind of the global average. But if you look actually in the U.S., that average is actually a little bit higher. We're expecting it to go up to north of $5 million in 2025 because these things, the costs are unfortunately are not going down; they're only going up. But the interesting thing is again, we're talking about healthcare here, is the global health sector. If you note, the cost of a global health sector-based breach is actually higher than if you were, say, in a manufacturing space or otherwise. It's about $6 million. It's probably going to almost reach up to $7 million by 2025. And that's global again. So the global average brings down some of the costs in the U.S. for the average, but in the U.S. it's actually even higher right now. And again, this is skewed a little bit because Change Health was such an astronomical impact. The numbers have gone up pretty dramatically here, but we're looking at north of $9 million for a healthcare-based organization for the average cost of a breach, and we expect that to be north of 10 million by the time you hit 2025. And again, we're talking about kind of where the areas of these attacks come in at. Compromised credentials still at the top of the list, which is essentially what you're talking about happened with Change Healthcare. We had a set of compromised passwords that were not MFA backed up, so somebody, a threat actor was able to get in and get access to credentials and move throughout the system. That's still the number one source of attacks is essentially it's human error, right? And then phishing, which also is a form of human error when the TAs are sending out these phishing emails and they're pulling in credentials, essentially stealing credentials that way. So when you kind of add those two together, I mean, north of 30% of what we're seeing and kind of the average cost and frequency of what we're seeing in the IR world here is tied to human error. So a much smaller percentage is really just software misconfiguration, cloud misconfiguration, failure to patch. Companies that may have, Office 365, but they have the lowest tier of product, and they don't actually have all of the security features turned on that, say, Microsoft 365 may offer. We see, a much smaller percentage of, malicious insiders, which we're seeing a little bit of an uptick here on malicious conduct internally. And essentially what that means is we're seeing TAs that are actually doing due diligence on employees and finding out that, Don his best, may not be doing his best on his finances, and maybe he, recently filed a bankruptcy. And a TA, we're seeing instances where a TA is tracking down that information, and they're directly reaching out and saying, "Hey, Don, if you give us your credentials here, we'll take care of your debts on the side." And they're actually paying insiders to gain direct access. So those are tough situations because there's really not a whole lot you can do about that, except for, again, do these exercises where you have kind of all the information at your fingertips. But let's kind of move on into kind of, again, discovery in the first 72 hours at any breach is kind of the vital pieces of the puzzle here, right? So our first decision point is really lies with ABC and Serenity, right? Because they don't have an IRP in place. We're really useful right about now, but what does ABC do with the impacted equipment, right? Everything that's locked down, the equipment, the systems, the servers, etc. What do we do here? All the IT assets, right? They're locked up. So option one, do we basically pull the plug, right? Do we take all the IT assets offline immediately? Obviously, there's some risk involved in that. Where we possibly have some systems that are churning along. If you pull the plug on, think about what happens when if you have your desktop and you yank the plug out of the wall, you get that, oh, we had an error shutdown, right? It was a unpredicted shutdown. So you possibly could be corrupting some things in your systems, et cetera. But that's one of the options here, really. Or two is we keep everything online, and we have Serenity, Ian over his head, essentially start, poking around to see if what he can find. Maybe can find out who this person is, the threat actor on some of the systems that we can still navigate through, although we know a lot of our systems are locked down here, right? So he's got limited access here, but those are really our two, that's kind of our first decision point here is what do we do? And I believe we should have a poll running, hopefully here on the side. Which should give us our first decision point here. I don't know if Autumn is going to run the polling here for us.
Yes, the poll is live. If you need to find it, it should be at the bottom right of your screen. There's 3 squares and a plus sign that will open some apps. If you click on that, it should give you the first opportunity to answer the survey question.
So we'll see that coming in live here. So let's see what everyone wants to vote on. Okay, we're seeing the votes coming in live here. So a couple more votes coming in. Okay. Okay. Well, we had both votes here. So we actually had, so again, this is why we do this, right? So we had well, overwhelmingly 90% of us said take all IT assets offline immediately. We have 10% that says we should keep the IT assets online and collect evidence so we can try to catch the bad guys here. So, well, since the majority voted for take everything down, let's see what happens here. Well, looks like we're starting off with the right decision here. So congratulations for those of us who voted to take the IT assets offline. We'll say maybe Ian over his head got lucky on this first one, right? So he decided, I don't know what else to do. I'm just going to yank the plug out of the wall, right? So in this particular situation, I'd argue that, yeah, it was probably the smartest decision to make in this situation, because really, ABC is at least initially mitigated any further harm that the TA can do, and can really now start preparing for, okay, we stopped the active, maneuvering through our systems here. So we can now take a step back. We can take a breath for 5 minutes here, and Ian can try to isolate some of our IT assets to, determine the level of malicious activity. We can kind of go back in and maybe reset, get our arms around some of the user admin credentials here, some passwords, and really start preparing our impacted IT assets here for some level of analysis. So that's so I would say, yeah, good call for everybody on that first one. But now, again, we do have an encrypted server sitting here, right? So we do have, and we have a TA, a threat actor, as we like to call him, who has hit us with a ransom note, right? They still have our systems locked up and they still have our data. So does ABC contact the TA and pay the ransom, right? So that's obviously, we got Ian over here that's saying, okay, let me try to figure out what's going on, but we're still sitting here. We have locked up data, locked up systems. We're not operating, so we're kind of a rudderless ship right now. So what do? Do we pay the ransom? 15 Bitcoin, surgical centers. So, I mean, let's say, the TA, again here, they typically do some due diligence on their targets beforehand. So they know that 15 Bitcoin is a sweet spot, right? It's just enough to really make you think twice. Like, should we just pay it and get our data back? So our decision point here, absolutely, we pay them because we need to be back up and running immediately. And if we pay, we can keep this quiet, right? We don't have to tell anybody. We can keep it not public. Let's go ahead and just pay this thing. So again, we have our next slide poll going up here on the side. Or we don't know what to do, right? So should we bring in expert resources to maybe help us make this next decision? Because we're kind of realizing, maybe Ian's realizing, maybe we are in a little in over our heads here. So what do? We pay it? We don't. Let's see all right, polling's coming in. All right. No idea. We need to consider bringing in. So, okay, a little bit shift here on 95% overwhelmingly supported. We feel like this is a decision. Paying 15 Bitcoin is just a little too much for us to make on our own. So let's go ahead and bring in some expert resources here. So let's see where we're running here now. Okay, so we're sitting back. We're like, okay, you know what? We don't know what to do, so let's try to bring in some expert resources. So Janice, in her infinite memory, right? She's sharp. She remembers, you know what? We just got some insurance that she thinks may cover this event. So again, she's like, who should we call? Okay, let me call the insurance company, right? So ABC decides we're going to contact our insurance broker immediately here. As again, one of those first phone calls out of the gate, your insurance broker can really, helps identify a potential policy coverage for the breach here and any incident response. We can figure out if, hey, you know what, that 15 Bitcoin, do we have coverage limits here? Would our insurance pay this ransom if we ultimately have to pay it? That's a good question. So we don't know. So let's bring in the insurance people here and let's ask. And then also, we don't really know what our options are here. So, some insurance policies have, panel limits and panel coverage requirements to hire experts and bring experts in. So it's a very, very smart, very good idea to inquire as it relates to any potential insurance coverage here, and very, very much ABC's in luck here. They have a robust cyber risk policy, and they actually have $1 million of coverage, and they don't have any panel requirements. So their insurance agent broker says, hey, yeah, you got $1 million in coverage. It's in place. So let's go ahead and figure out our next step here. Well, the benefits of doing that and picking up the phone and taking a look at your cyber risk policy here is because you have coverage, if you have a policy in place, to cover those expert costs, right? Forensics, very expensive. Ian, is your MSP, provider here, right? He's not really a forensics expert. And even if he is a forensics expert, it's a really good idea out of the gate to bring in a third party who's not affiliated with the organization and the current structure to bring them in to start taking a hard look at the forensics on the systems to figure out actually what happened here, right? Where did patient zero occur? Where did these guys get into our system? Legal counsel, obviously, a breach counsel is a huge role in any IR in today's world. Because for a whole host of reasons, which we'll get to, but the reality is you really need to have your legal counsel in the room as part of the process, kind of moving forward. Once you have a situation on your hands that's gonna be an incident. Crisis public relations. These are very challenging, difficult things to navigate, and legal counsel is not public relations. We don't pretend to be, and it's wise to bring in some experts who can help navigate or at least plan for some of the messaging that you may ultimately have to kick out to the public. Because if you're a surgical center and you're down, because you're not going to be back up and running, most likely you're not going to be doing surgeries for for a few days here, at least out of the gate, while you try to figure this out. So you need to be able to tell people something, and having crisis comms in place within that first 72 hours is definitely a good option. And again, insurance coverage, so they're going to pay for that stuff, right? And then the other thing is, if you on the healthcare side, if you have a PHI-based breach, depending on what your situation was prior to that IR, you potentially could be facing, regulatory fines and penalties from HHS and the Secretary of the U.S. Department of Health and Human Services. So we see it a lot where a facility comes under attack and has a breach. And then once you're navigating through that breach, realize that there were some things that probably should have been in place before the breach occurred. And now you're kind of have to answer to HHS over why you didn't have those things in place in the first place. And then obviously credit monitoring. If you have a breach where you have to notify people, consumers, patients, etc., the cost for credit monitoring can be pretty high. We typically see somewhere north of about $182 plus kind of per person that you have to pay to cover for monitoring. Some states it's mandatory for credit monitoring. Other states gives you the option. And again, as we get down to the next one, liability and defense costs, a lot of breaches result in liability after the fact for data breach lawsuits. So we're seeing a ton of those. Nowadays, you don't see a ton of like the asbestos litigation, plaintiffs' counsels running those ads. You see it advertisements for data breaches. So again, it's a huge area of concern right now, and so we want to make sure we have all of our options in place. So a good decision on calling in experts and bringing the insurance group into the mix here. So we're going to jump over then to our next, which is slide 15 here. So again, we have confirmed the insurance. We have our good broker who advises us, okay, you need to immediately hire your legal breach counsel here to help ABC. So again, does ABC go ahead and follow the recommendation of insurance and engage incident response experts to assist with and manage the potential breach? Again, two options here. Obviously, we can say, well, okay, we notified, our insurance, we have coverage here, but Serenity could potentially be saying, no, we got some of this, we feel like we can handle a lot of the forensics piece of this, so we can restore the backup to the data barn server. So we had some offsite backups here, so we can restore some of that stuff, so we can pick operations back up. We can really help you figure out the scope of the information here and what really was exposed, if we have PII or PHI that was actually taken off the system. And you know what? We have somebody, down the street from us that we have handle, notifications. We can do that. We'll be okay if we don't do this. We'll save you some money here. No, we just need to listen to our broker here. And yes, let's go ahead and engage those experts, right? Easy one, right? 100%. Let's go ahead and make that call. Easy decision. Let's hire a breach counsel and kind of move on with our next steps here. So again, we like to explain why. Why is that a good decision to bring in outside breach counsel? Well, so as outside breach counsel, many times we kind of act as the main point of contact, right? Kind of quarterback. We oversee a lot of the things. There's a lot of moving parts in any sort of incident response situation, and we become the direct point of contact that really helps to manage both from the investigation side as well as the response. And a key piece of that is privilege, right? So as the attorneys in the room, we can maintain privilege over the forensics reports, those investigations, a lot of those details, where again, if we're potentially thinking we may have some exposure here on the backside of this for data breach lawsuits, as much privilege as we can maintain over kind of the forensics here, we want to do that. So many times we enter into what we call third-party agreements, three-party agreements, where we directly will then contract and hire the technical forensics teams that come in, the security experts that come in to conduct the forensics. And then we have the reports that are then funneled through us as breach counsel, and we do those they do those at our direction to help maintain that privilege. We also, as breach counsel, we've myself, my team here at Dinsmore, we've been doing this for many years, right? And we have established existing relationships with incident response resources that really can help the clients contract on more favorable terms. So it helps the client out. It usually helps the insurance companies out as well. So we really have a lot of relationships that we like to leverage to help make things go smoothly. We also, I like to joke that I have the FBI on speed dial on my phone, and that's actually true. I just was talking to them the last 2 days in a row on another active IR that myself and my team has going on, trying to claw back millions of dollars by instituting a financial fraud kill chain situation. And we have those existing relationships with law enforcement. In my relationship with one of the special agents in the FBI over the weekend, I was able to text him and then call him and immediately get boots on the ground with the FBI to help handle that situation for a client. So having quick responsiveness for an IR is crucial. And then also, again, we like to we will ultimately be the ones planting that flag to really determine, as the law defines it, if we've actually had a breach here, right? So if we don't have a breach, then we're not technically or legally obligated to provide notice. So making that determination as to do we actually have a reportable breach is a huge part of the process here when we go through an incident response, right? Because once you plant that flag, that stake in the ground, so to speak, your timer starts to tick, right? And again, depending on if it's PHI and plus or minus 500 individuals, tells us who we have to notify and when. And again, you may have some reciprocal requirements based upon the state where the data is located, or the country where the data is located, or even if the data is located in the US, but you have individuals from other countries that are in your systems, because say you're a big hospital system and you have patients that fly in from overseas to have surgeries done here because you're world renowned for a particular expertise. You're going to have patient data in your systems that potentially could trigger notice obligations in other countries. So again, that's part of the benefit of having breach counsel in place. And then, if we make a mistake as breach counsel, we have malpractice insurance, right? So it's not really an area that, again, you definitely want to have a breach counsel that has handled multiple incidents as kind of part of your IR team for your clients. And as we move through here, we really want to have go to slide 18 here. So again, we made that decision. It was the easy one, right? To go ahead and hire breach counsel. Went through all the benefits, why it made sense, right? It made a ton of sense to do that. congratulations. ABC decides to go ahead and hire breach counsel to kind of help guide it through. So now, again, this is kind of a scary spot for ABC cut a lot, right? Because okay, should we bring in law enforcement? Do we need to contact the FBI? Because obviously, if you bring law enforcement in and you file a complaint with law enfortement, the chances now of kind of keeping things, more closed, hush hush, it gets less likely, right? So we have public filings. If we contact law enforcement, we may have public police records or FBI IC3 complaints, et cetera, that we now, the further out, the more people we notify, the less likely of this, being kept quiet is the reality. So, do we go ahead and make that call and say, yeah, you know what, we want to go ahead and bring law enforcement into the mix? Or do we really, are we worried about, okay, HHS here? We know we hired outsourced Serenity. We know they weren't perfect. They weren't top notch. They weren't really certified under HIPAA as far as being a recognized HIPAA high-tech, MSP in the space. We kind of did, the duct tape and bubble gum to keep things together for the last several years. And so our systems weren't great. So maybe we don't want to notify the feds, right? Maybe we don't want to get the police involved because we don't want to get ourselves in trouble ultimately here, right? So let's see. Let's run the poll here, see what's going on. Okay. There's a couple risk takers here. Let's see what happens. We'll get the polling. It's coming in. What should we do here? Do we want this thing to go public? Okay, waiting for a few more. I always love doing these. It's super fun to see how people I can't see you all, but I can feel the wheels turning, especially any other lawyers in the room, right? You're like, oh, like, do we want to do this? Do we want to pick up that phone, make that phone call? Should we do that? Almost there. A couple more. All right, so a little bit more. We got there's a few of us. There's a few that are like, no, maybe we should. Maybe we want to keep those not perfect security measures in place here. But we do have 90% of us say, okay, yeah, no, this is maybe a little bit too much. We have bad guys out there, right, that are trying to get 15 Bitcoin from us. Maybe we should go ahead and call the feds. So everyone, we'll go that way. So we got our next slide here. All right. So everyone says, let's call the feds, right? Let's pick up that phone. We say, hey, Craig, we know you heard you say you have special agents on your phone. Let's go ahead and do that. Well, as breach counsel, I'm gonna most of the time, unless it's some very strange set of facts that they're unusual. And I will say, obviously, every IR is so different. I mean, you can have similar facts. We have similar facts with Change Health, and even the facts that we're kind of fictitiously kind of running through here. But everyone is so specific as to the facts that you really need to have all of the facts before you kind of jump into these decision models here. But the FBI, my experience with calling the FBI is that's always more beneficial than not to get the feds involved sooner than later, especially if you're dealing with potential lost assets or actually dollars that may have gone out the door as part of any sort of incident response situation here. So yeah, initial contact with the FBA, right? So it's typically a top priority and one of the first things that we do in any IR. You have to go and file that IC3 complaint. So the FBI, the Internet Crime Complaint Center, maintains a site ic3.gov. It's kind of the repository for where all things start for the FBI's involvement in any IR. You got to go there. You got to give them the information. You got to file that IC3 complaint. And then luckily, because you hired breach counsel, we can then take that IC3 complaint and we walk it over to our special agents. We give it to them, on that Saturday afternoon when that call comes in, hand it right off to them, and they can directly take it, run it up the flagpole as they may need to bring supervisors involved. Or for this particular TA, if you remember back on slide 8 or 9, it was the Alpha V Black Hat group, right? So we know they're Russian based. We know based upon some of the intel that the FBI is going to share with us that they're going to send us to a field office that this particular ransom variant they're in charge of. So field offices, the cool thing about the FBI is they have different field offices, obviously all over the country. Alpha V, Black Cat, it could be Lockbit, it could be Vice Group, Vice Squad, it could be any number of TAs. This particular one, most likely they're going to route us through the Indianapolis field office. Again, they're going to be taking victim questionnaire. They're going to, be providing intelligence sheets to us as breach counsel that they're going to say, hey, yeah, we've seen this variant in, 15 other attacks. This is what they've done in the past. This is what we would expect them to do now. They will even tell us, even if for a minute we thought about, paying that ransom to much quicker recover our systems, the FBI is going to be able to help tell us, hey, these guys are known for kind of that double cross situation that happened in Change Healthcare, right? If you remember, Jen talked about this, that we had, a large ransom demand that was made, and it was actually paid by the decision makers for Change Healthcare. They paid it. Well, they paid it, and they still didn't get their data back. So that's one of those situations where the FBI would say, you know what, these guys have a history of taking ransoms and not giving you your data. So we don't advise doing that. And the FBI is not going to advise you most times to pay a ransom anyways. And I would say 5-6 years ago, we were paying a lot more ransom demands. Nowadays, we definitely pay a very, very, very small percentage, I would say. The FBA also, they have the FFKC process, right? So again, that's a very short window process where if you have dollars that have actually left your coffers, so to speak, your bank accounts, if they ended up overseas or if they ended up, in another, bank account somewhere that's controlled by a TA, if you institute what we call an FFKC process within that 72-hour window, there's a pretty good chance that the FBI is going to be able to help you get that money back. So again, time is of the essence in any sort of incident here. And again, the things that the IC3 complaint has, we have a questionnaire that we kick out to any potential client that comes in the door. With an IR, we say, hey, here's the information we need. You need, name the individuals filing the complaints. Well, obviously, we typically do that, on behalf of the client. We obviously need the details surrounding the business, contact information, any of the IT individuals that are involved, if you have forensics involved, if you have an MSP involved, details around the incident, anything that we know. We typically will share the intel with the FBI. So for instance, that ransom note that we saw at the first part of this, we're going to make screenshots of that kind of stuff and give it to the FBI because that's going to help them identify, the TA involved here. It's also going to give them intel on their side that they many times can use to help us guide our investigation, right? So they may be able to point us to, hey, these guys are going to be most likely dropping, your data on an auction blog, or they're going to be posting it on the dark web. Wait, 48 hours or 72 hours, and we're going to see some activity. And they'll start monitoring or help you start monitoring that, or point you to a Tor site or an Onion browser that your forensics team, a lot of times we'll bring in dark web monitoring companies that will start searching for details and information around the TA to kind of get a feel for what the exposure is here. And again, they're going to share intel here. So it's always good, in my opinion, and I think the rest of the group here would agree. It's always a good idea to bring the feds into the room. So now we're off and running, right? So we've really we're still right that first 72 hours. We've had some solid decisions. We've actually had a good group here who've made. I'd say we've made about 90% of the group has made the correct call as we've gone through the simulation here. We've contacted insurance. We've hired breach counsel. Breach counsel now can go ahead and start engaging. Again, we've called the FBI. We can start engaging in some of those privileged forensics investigation reports and analysis. And that's a key piece of this puzzle, right? As we go through any IR, is you really need to understand. And HHS is gonna ask you, like, how did this happen, right? So how did we end up here? How did we end up with 25,000 patients, PHI exposed and exfiltrated out to the dark web? How did we get here? So having those resources in place where you can, again, start that initial analysis and getting the forensics experts, the team in the room is a key part of that first 72 hours. So again, they some of the first steps that they will typically take is they're really going to take kind of an inventory, right? They're going to take a snapshot of the impacted IT assets and the system infrastructure. They need to have a foundational understanding of, like, what do the systems look like here, right? So in this particular case, we talked about there's multiple locations all over the state of Ohio, but we had some centralized systems, right? Some administrative tasks that was done in a central location. We're going to be providing kind of the scope of the incident as we know it. So, Don, who was doing his best, who came in on that Monday morning and clicked on his computer and saw that note, we're going to be talking to Don and say, Don, what happened here? Did something happen here as part of your daily activities where you really you clicked on something, or how did we get here? And as part of it, again, they're going to be really working, and we're going to be working with them to put together an SOW for all of the services that they're going to be preparing at our advice and direction. Because again, we want to do everything here to maintain privilege over these reports. It's kind of vital because we are anticipating that we know we have a breach here. We're anticipating that we want to have some coverage here, and anticipating those potential lawsuits kind of coming down the road. The other thing that the forensics teams are going to do, they're going to come in, they're going to say, you know what, Serenity, you were doing your thing, things were okay for a couple of years here. We really want to bring in some solid, modernized tools that have really high levels of managed detection and response solutions. So EMDs or EMRs, Sentinel-1 being one of the most commonly deployed tools that we see our forensics teams will bring Sentinel-1 tools in, and they'll scan the systems, and we'll typically get a lot of intel back from the system scans when they're using Sentinel-1. A lot of AI now on the forensic side, so we're seeing a lot of high-end use of artificial intelligence to help refine and get better scan results when we're doing the Sentinel-1 kind of forensics. And then from the forensics findings, right, from just some of the initial steps here, we can really start taking a step back and starting to take a look at the bigger picture here, right? Gathering all the information for that we will need to inform on breach reporting obligations. We're going to be gathering those additional facts we're going to be sharing with discussions with the FBI. And potentially, depending on our fact pattern here, our situation, we may be wanting to negotiate with a TA, right? So again, we bring in experts that help negotiate with the TAs, because maybe we're not going to pay these guys, but maybe we want to delay. Maybe the FBI tells us, you know what? Our initial forensics has said, yeah, these guys actually exfiltrated some data here, right? So they got, say a terabyte of our data that they were able to take off. We shared our ransom note, right? What are the elements of what was exposed here? So our forensics are going to say, okay, well, we have some data here. Some of it, maybe it was already public data. So we don't need to really worry about that. But another bucket of it, if you remember the data barn, that was PHI was stored in our data barn. So that's clearly sensitive information that we need to know to help make some of our decisions, But a bigger question always comes about. Our forensics teams can say, okay, well, yes, they exfiltrated our backups off the data barn, but were they encrypted? Were those backups encrypted at rest? Meaning that even if they got the backups and took it off the system, if you're using AES 256 encryption, for instance, bank grade encryption, you're not going to be able to open those things. So that becomes part of our fact analysis as far as, do we actually have a breach here, right? So again, then identification of the actual TA. We've seen TAs hit us with ransom notes that says, hey, we're this group. But then when we actually go, or have our experts go track those onion browser links, we see that it's actually a different TA. The TAs will kind of, they hold themselves out to be other TAs. And so, and the FBI can help you kind of navigate some of those, those tricky tricksters there who like to make you think that you're talking to one group when in fact you're talking to another. And then our experts also, again, I talked about the dark web monitoring. So what are these guys actually doing? Are they actively talking about us on the dark web? Are they mentioning ABC cut a lot? Has any data actually been posted? Is it actually exposed? Is everything we're doing here like futile because they've already dumped our data out on some scarlet letter website so it doesn't matter if we pay them, it doesn't matter what we do, like our stuff's already out there. And so those are the situations that those forensics experts, they can really help you kind of figure out, kind of helping to make through some of those decisions. But as we've gone through kind of the simulation here, I want to kind of take a jump out a little bit. And we'll say, okay, the first 72 hours, we made some good decisions, right? We called breach counsel, we have insurance, we have good forensics, we have a good scope of work. They're working working our systems, trying to figure out what's going on. It's been about a month now, 30 days out. So we haven't ticked any actual, notice, obligation yet, because even if we noticed on day one, we typically have 45 to 60 day window depending on the breach laws of the state that we're operating in. A lot of them will just have within a reasonable amount of time. Change Health, if you noticed, nobody got notice. That happened back in February, and people are just now starting to get notices, and you're talking months after the fact. So 7, 8 months later. So again, that's part of it. But just to take a zoom in a little bit, and like now let's actually take a look at what was actually going on. Right now we have a month here of logs. We have some preliminary forensic report findings that our forensics team has been able to pull together for us. And the log files here show, are showing us the initial system access and the TA's last access to the system. So that helps us say, okay, when did they actually get in to the system? When was day one? How long did they end up being in the system? Where did they go? We're able to find out their method of access. So kind of how did they actually get in, right? What was patient zero? So in this particular instance, it looks like a phishing email from what appeared to be a known vendor had come in. And then we can identify, that machine and user who was actually patient zero. In this particular case, we have a presence of an encryption key that was discovered on Don's desktop in a file called patient insurance file. So that's part of our analysis here where we're like, okay, well, Data Barn was exposed, but secondarily, now we know that Don, he was doing his best, and he was trying to make his job easier, but he actually had moved over to his desktop and saved a local copy of patient insurance files, on his desktop. We can find out that the tools, that there were some tools that were actually used by the TA to move across the system to deploy the ransomware here. And two common ones, in particular, what was used as part of Change Health, as well as some other ones. Mimikatz is one. Cobalt Strike is a very common one that we see a lot, where that happened in this particular situation. So we have a TA who's using an advanced tool that helps sweep up their their footprint, so to speak. So it makes it difficult for us and the forensics teams to really get a 100% clear picture as far as everything that they did touch. Everything that they may have exfiltrated. So it makes our jobs difficult here when TAs are using tools to cover up their tracks. And then again, confirming exfiltration of data in this particular situation, because they use Cobalt Strike, some of it is unknown because they swept up their footprints here. So encryption of the Data Barn. We find out, okay, yeah, we had some level of encryption here of the Data Barn, but our forensics team was able to say, you know what, though? We had unencrypted TIFF images that were stored of both driver's licenses and insurance cards. And we have, 10,462 patients, clients that their information appeared to be stored in an unencrypted environment that our Alpha V Black Cat TAs were able to get their hands on. And then the other thing is we're going through and saying, you know what, we're about a month out. What's the dark web showing us, right? So in this particular case, we start seeing some chatter, right? ABC's name is showing up now on some of these dark web blogs and some of these reports. We also get a snapshot as it relates to kind of, okay, what's the current status of our system infrastructure here, right? So are we back up and running? Do we have to go buy new servers? Well, our forensics team is going to be able to say, okay, as we're reviewing all of our systems, we got to clean them, right? We got to make sure if we fire a server back up, because if you remember at the start of this, we yanked the plug out of the wall. We got to make sure if we plug that server back in, we're doing it in a safe environment. We got to scrub it. We got to make sure there's nothing lurking on that system before we fire it back up. And then we're going to have some recommendations from our experts here to do some things to help decrypt servers and systems and help out with, ultimately with how do we get back up and operational. And then again, helping us to begin the analysis of our notice obligations here. And I know that the notice is a huge strategy. And I'm gonna kick this back over to Jen and Laura and some of the others in the group. We're gonna weigh in here on kind of going through some of our thoughts on how we develop our notice strategies and how do we really kind of make those decisions on kind of best practices here. And I'm going to kick it back to Jen, Laura, as we kind of get into some of those discussions here.
I'm happy to jump in. I mean, like Craig said, these are very difficult decisions that we have to make with our clients. We need to look at each state that is impacted. We need to look at all of the considerations and timing and make sure that to the best of our ability, we meet those individual notifications. But more importantly, if we've got a large number of individuals, we're going to have to prepare a notice to provide to the media. We're going to have to determine whether or not the number or the cost is so high that we do a substitute notice to national media potentially, which would then require, some finessing of the wording and making sure that whatever we're putting out there, when we have questions, we can answer those questions. There's a big question around credit monitoring, right? When do we offer it? When do we not? And you look at what type of information has been exposed. Do you have social security numbers involved? Do you have more sensitive medical information involved? What could they have that they could then use to steal somebody's identity? So for example, in the Change Healthcare breach, where people are just now receiving notifications, personal experience, I received a notification letter from my daughter. She's 14 years old. What is also troubling is that I'm getting lots of credit card applications, free credit cards in the mail for my 14-year-old, which prior to this breach and her name being and her information being out there, I wasn't receiving in the mail. So, even as a lawyer who handles these things all day long, every day, you can't prevent the breach from happening to you or your loved ones. So we look at, and I always look at too when I'm advising clients, if it was my patient, my family member was a patient involved with this breach, how would I want them to be treated? And I do think that those types of considerations come into play too, in terms of identifying people who should receive offers of credit monitoring. And then with those offers come a lot of other things that you can use to ensure that if your identity has been, or your information has been taken, that you are monitoring whether or not the information is out there for further use, that you are getting insurance against financial losses, or that if you have your credit score impacted, that you are utilizing those resources to repair. So those are the types of things that go into what you decide to do in terms of the notifications you provide. But I always talk with clients about just, again, making sure that you do right by the people who are impacted.
Yeah, for sure. And I like to throw like a curveball here. Because it's like, yeah, you're going through all this stuff, right? And are you making the right decisions? And and then just when you thought like you had this full thing figured out and you got, credit, you got your known number of people here impacted, you're trying to make the decisions on credit monitoring, all this kind of stuff, and you're back up and running, and you've got new server systems, secure machines, finally feel like you got a handle on the breach. And then your forensics team, who is monitoring the dark web activity, sees a full-on legitimate post naming ABC, referencing the ransom attack, and indicating that now all the data is up for auction to the highest bidder, right? So the ransom didn't work for them, but guess what? There's two ways that these TAs can make money, right? So one is by you paying them directly for the encryption keys to unlock your systems. But the other one is if they did exfiltrate your data, they still have your data. And they're going to try to auction it off and sell it to the highest bidder. So as we kind of come towards the end here, I like to throw out this kind of curveball. It's like, okay, you think everything's going great. Now you got this new decision point, right? You thought you're out of the woods. Does ABC go back and say, okay, shoot, we really, we thought we could maybe keep this a little bit more under wrap. Okay, maybe we're gonna have to notice, maybe 10,000 people or so, but we didn't want the whole world to know. We're gonna try to keep this thing under wrap, and so do we go back? Do we engage the TA and say, okay, there's now this auction that's going on, and they're going to sell it off to the highest bidder? Because again, these organizations, they are very well run machines, and do we pay for it? Do we pay just to, we're up and running, but the data's still out there and exposed. Do we pay to get our data back? So that's kind of one of our last slides here. I'm going to let this poll run here for a little bit, but it's always this this interesting dichotomy, because you're like, okay, TA, we're not going to pay you to for your ransom demand. We're not paying you 15 Bitcoin to get our encryption key back. We have experts now. We're recreating our systems, and we're going to put all that money towards those insurance dollars, that $1 million of insurance dollars. Instead of paying a ransom demand, we're going to put that into building our systems back up and making them bigger, stronger, better. So what are we going to do here? So this one is coming in pretty split. It's always interesting to me because you can see both sides, right? So because in theory, you can, the lawyers on the webinar here are gonna, if we can figure out any way not to have to kick out notice, right? We're gonna try to do that. And if we can somehow say, oh well, yeah, they got our stuff, but we paid for it and we bought it back, so we're good, right? We should be good. So these a lot of times can be a toss up, and it's funny here. It's no different. We're actually seeing, it's pretty close. About 60-40. 60-40 says no. 60% says no. 40% says yes. Let's talk through it a little bit. So again, these are honestly, these ones are tough because it ends up typically being a flip of a coin at the end if something like this happens, and Change Health, they decided to try to make a payment, and it's always a risk, but these are just some of the things that we've been exposed to over years of handling these, right? So some considerations when you're trying to make this decision on, do you pay these guys, right? Well, we made the right call. We have law enforcement involved, so we have the FBI, we have outside legal counsel. But let's talk about kind of the TAs here, right? The threat actors. Many of them operate very, very legitimate, still criminal, but legitimate business models. They have project management teams. They have groups that they're 9-to-5 jobs. They come in, they work, but their work is to try to find ways to break into your systems, or their work is to try to break into ABC cut-a-lots, surgical centers, or the hospital systems, or whoever. That's their job. They don't get paid unless they're successful, and not only are they successful, but that they can either ransom for an encryption, or they can sell your data to the highest bidder. So Again, proof of life is part of these. If you remember in the initial note, they gave us a little snippet of the proof of life, but those encryption keys, sometimes they work, sometimes they don't. So the question about whether that encryption key is actually functional, and actually is going to unlock your servers or system, that's part of the analysis. As it relates to an auction option here, which is what the TA is doing now, it really comes down to this assessment of, again, the intel that you have from the FBI. And do you believe these guys, right? They're criminals, criminal enterprise. Are they actually gonna, if you say, yeah, we're gonna bid on this auction, we're gonna pay you for it. What's the guarantee that these guys don't keep a copy, right? So you're gonna take their word that they're gonna destroy all the backups. They're gonna destroy the copies that they inevitably have, probably in multiple onion browsers in multiple locations around the world. Are they actually just going to give you the stuff back, to the highest bidder, and not give it to others? That's a chance you take. And the intel says some do, some don't. I mean, there's kind of a rating system out there on the TAs where some of them have, some higher ratings than others that they say, okay, yeah, if you pay these guys, the chance of them actually following through is relatively high. But again, it's a scary call to make, to say, yeah, let's go ahead and do an auction, because a lot of times what you'll see is, even some of the ones that have good ratings, they get taken over, or whether they're part of a state sponsored criminal enterprise. We see a lot of those as well, where you have just like when buying and selling a company, if you acquire a company and the company did things a certain way for a number of months or a number of years, and then they're acquired and they take on new leadership, you end up with new decision makers, and sometimes they change. So sometimes the TAs make changes at the top too, and so the one that would follow through now, maybe somewhere they kept a copy of that data, right? And they're now going to make a second request. So you're going to pay them once, and then a little ways down the line, they're going to ask, okay, well, we kept the copy, so if you want this one, you're going to have to pay us more money. So that's definitely a risk that you take. Change Health it was a victim of a double payment extortion demand, so it happens more frequently than you would like to think. Some additional considerations, and do we negotiate with these guys? Obviously, with the FBI involved, you have OFAC, right? You have the requirement to find out if your TA is on the no fly list, right? The no pay list, that's governed by OFAC, because if you pay somebody that's on the OFAC list without approval, you can get in trouble. So again, you have OFAC issues you need to consider. You have state regulatory agencies that, if you pay a ransom, you have to disclose that. And then you also are going to need to get authorization from insurance in any of those type of situations. If you're paying on a bid on an auction, or you're paying a ransom, you got to get authorization. So a lot of things to consider there. You also, obviously, on the other side, playing devil's advocate, sometimes it's cheaper to pay these guys, because it's way more cost effective to pay either a ransom or an auction to get your data back than it is to recreate all those lost systems. So some companies, some systems, they do take that into consideration when they make that call. Also, the reputational impact, right? So if you don't make the payment, then you'll have the naysayers out there say, well, why didn't you make the payment? Why didn't you protect our data? Again, those are tough decisions, because a lot of these guys, pay it or not, the chances of a criminal making a decision that's, say, 2-3 months down the road to expose that data anyways is relatively high. Again, these are all very factual situations, and it really is. It's the wild, wild west. I know Jen and I have gone through some crazy situations, and you never know what curveball you're going to get thrown, but you really need to have, again, the reason why we do these exercises here is because we want to help kind of be thinking about these before it actually happens to us. So as we kind of get into the end of the time here, again, we have our forensics team, we have breach counsel reports, which really at the end of the day are going to really help us to kind of mitigate our damages, or they're going to help us to put together some best practices for how we got here, how we're not, how we don't want to end up here again. Don't be the next Change Health, right? So I really want to, kind of bring back in, Jen and Laura and everybody here to kind of talk through some of the, the areas of assessment and improvement that we like to talk to our clients about. So if everybody wants to jump back in, we'll kind of talk through some of the organizational steps that you can take to strengthen your organizations or your clients' organizations. If they haven't gone through one of these exercises, it's usually pretty impactful. So I don't know if anybody wants to jump in here.
Yeah, thanks, Craig, for that exercise. That was very insightful. One thing I wanted to add from the previous slide when Jen was talking about, notices and everything is one thing to remember for all of my covered entity clients, like my hospitals and other facilities, is that the covered entity in a HIPAA breach situation holds the requirement to notice the individuals. But there are a lot of situations these days that I've been seeing where in situations where you have a business associate who has a breach, the business associate is going to make an offer generally to send out the notice on behalf of the covered entity. And that sometimes I think you want to pause in those scenarios and do an evaluation of what is going to be best for you and your client and the individuals that you're noticing. For example, I just worked with a client who had a business associate who had it was a pretty small breach that didn't affect many individuals at the practice. So we went ahead and elected to have the business associate send out the notice on behalf of the practice. And, one of the reasons we did that is because we want all of the reputational issues that might come from that to be put on the business associate. And we don't want the patients to think that essentially we did anything wrong. But there would be some instances where that's not a universal election that you would want to make. And perhaps you would want to be the one as the covered entity that controls the message. So just something to think about when you're thinking about communication under all the notice requirements.
Yeah, for sure. And so if there's any questions, we're going to throw out, if there's any questions, feel free to throw any questions in the chat. And again, these last couple of slides here, we're going to really kind of key in on some of these things that, like, okay, we went through the simulation, but can you, your clients, can they answer these questions? And again, if there's any questions, throw them in the chat. All of our information will be, and we're going to share all these out, I think after the fact too, but Jen, Laura, whoever else wants to kind of talk about some of these questions and kind of how we ended up where we're at right now.
Yeah, I can jump in a little bit. I mean, from a healthcare provider, covered entity perspective, even a business associate perspective, a lot of these things can be really hard on the organization. And you look at, the impact, across your, resources internally as well as externally. You just need to make sure that you've buttoned down all of the things that you can do. And when I say that, I mean, we look at the causes of these breaches. And to your point, Craig, a lot of it comes down to making sure your employees are properly trained, regularly tested. Our law firm sends out these phishing emails and I receive them and I identify them as phishing and I get the gold star of approval. Are your organizations doing things like that to make sure that employees understand what is and what isn't? Because some of these things look legitimate. These emails are more and more often than not almost something that even I, as a trained attorney, having done this for 25 years, am like, I wasn't expecting this email from this person. This is not a person that was supposed to send me an attachment. Just looking at these emails with a suspicious eye, and maybe it is legitimate, but I'd rather be safe than sorry. So those types of things that you can do to lessen your risk. I think a big one has to be making sure that you improve or maximize your educational opportunities for your employees is the way that I would put it. I mean, as far as healthcare providers go, obviously OCR is nowadays investigating almost each and every one of, if not every one of my clients who submits the over 500 notification. And because they have to do their due diligence. They are not as often imposing penalties, but they are still imposing penalties where they see things that are going on within an organization that just shouldn't be. So, and I know we're running out of time, but you don't have the policies and procedures in place. You don't have a regular security risk assessment, either annually or every other year at least. Those types of things. If they think, okay, wait, this is a business associate breach, and they didn't have a business associate agreement. HIPAA's been around now and in effect, and we've been enforcing it since, I don't know, I think they started enforcing in 2003. So it's been 20 plus years now, and some of these healthcare providers are still not getting it. Those are the people that they're coming after and instituting major fines and penalties upon. So I'm going to let somebody else chime in before, I know we're running a few minutes over. But those are just my quick thoughts, making sure that you're doing all the things that you need to be doing.
Thanks, Jen. Yeah, I would echo that. Every breach that I've reported on behalf of clients, my clients have received a records request from HHS after the report, and that can be very intimidating and scary if you don't have the basic items that are on the records request, like your latest risk assessment. So something to keep in mind. Thanks everyone for attending today. I'll just wrap it up here. If you didn't see the chat for CLE credit, we'll be sending you an evaluation. We have Ohio and Florida credit available. And if you need another state, we can provide you with a certificate of attendance. And then your 2 code phrases for purposes of getting credit are data breach and change healthcare. And again, those are from Autumn in the chat. So you can screenshot that if you want to, so you can remember it. And thank you so much for attending. Let us know if you have any additional questions. You can reach out. Thanks, everyone.